Over the years, we've met several patients from Spinal Balance Health Center. They've had some experience with headaches. They've had some neck pain. Some others, fibromyalgia is one of them.
But the most common issue for patients is low back pain. We're going to focus on that this morning.
Dr. Drew Drummond, it's always good to have him back here on the Blend.
Hi,
good to be here.
A
regular guest. You've been on the show the last few years.
It was like 5.
Yes. Has it been 5 years?
It's something like that. Yeah, a long time.
Let's talk about low back pain. I got a little kink in my low back.
You and everybody, right?
I know everybody's got some low back pain.
True.
But what are the causes? Why do so many people have trouble treating low back pain? It seems like this thing just lingers and lingers and lingers.
It does. About 80% of people will end up with low back pain at one time or another in their life. And the reason it's so hard to correct is because the problem doesn't start in the low back. The problem starts somewhere else in the body, and the low back hurts because it's actually the solution to the problem, not the problem itself. Yeah. So when the body is nice and centered and balanced with gravity, there isn't a lot of stress in the joints, but when it's imbalanced, then it forces an adaptation, and that happens in the low back. What we correct is a misalignment at the top of the neck that leads into some of these imbalances. So if you look at the picture on the screen, the right-hand side would show what happens if all the muscles are pulling nice and evenly on the framework. And it's muscles that control posture, nothing else. So there you see even shoulders and hips and legs. But on the other side, on the left side, that would demonstrate what happens when the very top bone of the neck is misaligned through some kind of an accident or an injury. And it will cause the nervous system to lose proper control of the back muscles, making one side tighter than the other. And the real crux of the problem, if you look way at the bottom of the right leg, you can see it's elevated off the ground because of the contraction. So the body has to adapt to that. Yeah. And the low back is the area that takes most of the brunt of the punishment.
You can see it there. It's like, I mean, there's a very clear kink at that low back. It makes sense what you're saying.
Yeah.
What'd you bring in?
I brought a dumbbell in to demonstrate this. I use
multitasking?
Yeah, well, I use this in my office. It's kind of good to demonstrate what happens when the body's off balance. So as I'm standing upright, this would be a nice balanced posture where all the forces of gravity pulling on me are being evenly distributed through my whole framework. There's no joint that carries enough stress to wear out. Yeah. But if you pick something like a weight up, I don't just pick the weight up and fall over on my face. Yeah. I adapt to that. And the way you do it is you just shift your weight just slightly. And the good thing about the weight is I carry it where I'm going and then I put it down. But if you have an atlas misalignment, you constantly have that imbalance and you're constantly adapting, and that stress in the low back goes for years and years and years sometimes before it finally starts hurting. But then when we adjust the atlas, it's just like putting the weight down. You adjust the atlas, the nervous system starts working better, and then the low back doesn't have to compensate.
Great analogy.
Better. Yeah. And this is a holistic approach, wouldn't you say, to treating back pain? Or
I would say so.
How would you describe it?
I don't even, that word, before I became upper cervical doctor, I thought of holistic as kind of a granola hippie kind of word that I didn't like. But really all it means is we're treating the body as a whole organism. We're not just treating a symptom, but just getting the whole thing functioning better. And when we adjust the atlas, all we're really doing, the main goal is to get the central nervous system functioning properly.
Well, yeah, and you're not using medication, you're not using painkillers to cover up the pain.
No, a lot of people with low back pain, the first place they would go is to their medical doctor to try and get some pain relief, and one of the first things they'll try is a muscle relaxer. So that temporarily will relax the muscles and make the back feel better, but it really doesn't take care of the problem that's leading into it in the first place. So those would be more symptomatic treatments that are sometimes good and necessary, but unless you get to that underlying problem with the whole body, you're not going to fix it.
Well, sometimes if the pain is so bad, you'll try anything just to get rid of pain.
Yeah, and there's all these treatments are good in their own place, but you will treat it forever that way if you don't eventually start looking to the source of the problem, and the atlas is a lot of times it.
If you're experiencing low back pain, you don't want to go through more pain in some kind of treatment to fix the original pain. I mean, that's sort of the cycle for people. The care that NUCCA care, these treatments, are they uncomfortable in any way? Describe the sensation when you lay down on a table for an adjustment. What's it like?
Yeah. It's really painless. A lot of people will come in here, pardon me, with low back issues that have had active therapies on their low back that were uncomfortable. So they kind of like this, where
what are you
we
doing
are at the top of the neck. we have this patient lying down, and it's just a very gentle hand adjustment where we design a correction specifically to that person's misalignment through an X-ray analysis. And then there is a direction of force we're putting into the neck in a very gentle way that I almost wish it felt like more.
Right
That's
there?
it right there.
That's it.
Yeah, she doesn't wince at all.
No, I wish it almost felt like more because people have a hard time believing it does anything.
You didn't do anything, right.
Yeah, but luckily, before the adjustment and after, we show people their posture, and it typically evens out immediately after we're done. So they
know it works.
yeah, but it's light, it's gentle, there's no pain.
Sure, they know it works because they can see the before and afters, but how about people that, how do you know if you're a candidate for that type of care?
The first thing I do when a person comes into my office is I look at their posture, because you can see if there are muscle imbalances and it's forcing the body to adapt. Whether or not that is happening because of an atlas misalignment always requires x-rays. So the first day anyone comes in, if I see all those indicators of an upper cervical misalignment, we'll then take pictures like you see here and analyze them, and that tells us how to correct it. It tells us if there is a misalignment, and that's sort of the process.
There's a whole lot of trigonometry when you're looking at angles, because everybody that comes in, it's not like you can do the same sort of treatment and it's going to work from patient to patient. It really is specific to that person and what their atlas is up to.
Yeah, it really comes down to physics and geometry and biomechanics. You look at the atlas misalignment is compared to the neck and the head, and then figure out how it's off, what you need to get it to be put back in one place. And it's much more complex than just an x-ray that wouldn't, or an adjustment that would be more of a thrusting correction without an x-ray. This really, there's a lot of process that goes into this.
Dr. Drummond has joined us for a long time. In fact, I would guess now you've probably been here more than 50 times, and most of those visits you brought a patient with you. If you're just hearing about NUCCA care and you're like, boy, I wonder what people who've done it had to say about it, I'd encourage you to go to our website and just search Spinal Balance and look at some of his past clips and see if there's somebody there whose story looks a whole lot like yours. We've got a special offer too that I think might make it even more appealing for you.
Yeah, here it is right here, the special offer. The first 15 people who call Dr. Drummond's office are going to get that, well, it's basically a consult, and then you get the exam, and you get the x-rays, which, you know, x-rays can cost a pretty penny.
All of that.
It's a really good offer.
Yeah, $50.
You don't say, Dr. Drummond.
It is Spinal Balance at yahoo.com. If you just want to shoot them a quick email, or just go to their website, spinalbalancehc.com.
Thank you, Dr. Drummond.
Good to see you, Doc.
Thanks for having me.
It's
good to be here.
Your dumbbell with you.
I'll take it. I wouldn't want you to have to
working out
exercise
in the
while I'm
commercial
gone or
break.
anything.
Do you love to save? Shop